This video will provide an overview on the new tiered violence alerts. The video will review where to find alerts and how to locate their associated care plans in Cerner. Let's quickly go over what's changed with violence alerts before reviewing where to find them in Cerner. Previously, there were only two types of violence alerts: history of violence risk and risk of violence. History of violence risk remains an alert for patients who had previously received a violence risk alert and don't currently meet any other violence risk alert criteria. New tiered violence alerts have been added. Violence non-physical is a risk alert for patients who have displayed non-physical violent behaviors towards others. Examples include verbal insults or threats of non-physical harm. This can also include problematic sexual behavior and destruction of property not directed at others. Violence physical is a risk alert for patients who have displayed physically violent behaviors towards others. Examples include physical intimidation or physical or sexual assault. It also includes verbal or written threat of physical violence. Violence severe is a risk alert used for patients who have committed extreme and/or recurrent violence requiring extraordinary resources and interventions. This includes attempted mass casualty and severe psychological harm. Next, let's review where to find alerts. All processed alerts will be front-facing on the banner bar. You can also find the alerts in Patient Overview under the High Risk column. Click into the field next to your patient to open the preview window to find more detailed information. If you use Tracking Shell, navigate to the Alerts column. Hover over the purple icons to see alerts. In ED Launch Point, find the alerts under the Room column. Click on the space next to the patient's name to open the viewer pane. Also find alerts here. Click the Critical Notes hyperlink if you want to review documentation. This will take you directly into the patient's power chart. Next, let's review how to find care plans for your patient directly from their power chart. Navigate to Provider View and from any one of the Workflow tabs, select the Documentation component. Click the Change Filter button and select Care Plans, then select Apply. Changing the filter will allow you to quickly find the Violence Risk Care Plan. Remember to change back your filter setting to your preference. For physicians at PHC Long-Term Care, a reminder: all care plans are documented in Momentum. Care plans are printed and filed in the resident's chartlet on the unit. Remember, there may also be a violence risk care plan created by the acute team in Cerner. A resident may have had an incident while in hospital. Thank you for watching this video. If you have questions or require further assistance, please do not hesitate to reach out to the PHC Education Advisors for Cerner.